Today we're going to learn about a manual muscle test for the Flexor Digitorum Superficialis. So first of all, what is it and how do you do it? Well, it helps determine the strength and the function of a muscle during movement. So it can detect weakness or other muscle imbalances, maybe due to nerve involvement, disuse, weakness, pain, fatigue. So the therapist is going to apply resistance. So for instance, with the biceps, everyone knows the biceps. The therapist is going to stabilize at the elbow. And also, they're going to pull down into extension. So by them doing that, that means that the biceps are going to be contracting, which means that those biceps are really working. So take Popeye, for example. He has pretty strong biceps. I'm going to draw a therapist and a little stick figure that's going to perform the test on Popeye. And because Popeye is so strong, he could probably hold his arm in that position at max resistance. So me pulling as hard as I can. So I would give Popeye a 5 out of 5. However, some people may not have any muscle contraction and they'd have a 0. So the flexor digitorum superficialis is actually a flexor muscle of the forearm, and it's in the intermediate layer. So you can kind of see it's beneath the superficial layer there. So the origin of the FDS, it has two heads. So the humeral ulnar head is on the medial epicondyle, which is drawn here, via the common flexor tendon. And then you also have the radial head. And then they're going to insert on the shafts of the middle phalanges of digits 2 through 5. So I'm going to circle the middle phalanges here. So circled here is going to be the proximal phalanges, so this can kind of be confusing. So the proximal phalanges are here, and then we have the middle phalanges, which is where they insert, and then you have the distal phalanges drawn in these little circles here. So the FDS is going to be innervated by the median nerve, which I'm going to circle here so you can see that. Great. So next we're going to look at the action of the FDS, which is the flexion of the wrist as well as the middle phalanges at the PIP joints, which is the proximal interphalangeal joints of digits 2 through 5, which means not the thumb, so digits 2 through 5. So I'm going to add a little picture here, which you can actually pause to get a better look at, but it just gives you a nice view of the hand. You can see the phalanges, the metacarpals, and the carpal bones kind of in relation, everything. So I'm starring and putting in red the middle phalanges and the PIP joints, which is important to the FDS, but also you can see the DIP joints, which is between the middle and the distal phalange, as well as the MCP joints, which is between the metacarpals and the proximal phalanges. So those are just important to know. So looking at the hand in its motion, you can see the PIP joint here, and you see it being flexed, and you see the yellows is on the middle phalanges. And then also it's gonna have wrist flexion, but it's just not seen in the video here. Now we're gonna take a look at a proper manual muscle test of the FDS.
Today we're going to do a manual muscle test of the flexor digitorum superficialis. A manual muscle test is just to test the strength of a muscle. And to do this, we'll contract the muscle in its action, and I will just apply a little bit of resistance to test the muscle's strength. In order to proceed with this test, I have my patient sitting in the chair with her arm supinated and her elbow slightly flexed. The patient's arm is exposed in order to do the test. So the flexor digitorum superficialis originates at the medial epicondyle and extends and inserts on the middle phalanges of fingers 2 through 5. The action of this muscle is to flex at the PIP joint as well as at the wrist, like so. So I'm going to passively move you in the muscle's action. Okay, great. So you could actually do this actively by yourself. Okay, so you're gonna flex at that PIP joint and also flex the wrist. Okay, great. Now in order to do the test, I'm gonna have her do the same motion. I'm going to stabilize at the MCP joint, and I'm going to apply pressure on the middle phalanges and push into extension. Okay, so remember to breathe as we do this test. Also, it should be noted that we don't want the DIP joint to flex, as this is the flexor digitorum profundus that is going to compensate for the motion. Okay, again, remember to breathe. Okay, hold. How does that feel? Good. Okay, I'm going to test each of your fingers. Okay, I'm going to apply pressure to that middle phalange in the direction of extension. Great. Remember to breathe. Again, hold. Great. And here we go. So I'm trying to get that DIP to come. Okay, great. So I would give her a 5 out of 5 as her results, as she was able to hold at my max resistance. The only thing to note is the DIP joint kicked in a little bit on the pinky, so maybe the pinky would get a 4 out of 5. In addition, I would bilaterally compare her opposite hand.
So I see in the video, the FDS kind of has a little cousin, the FDP, the Flexor Digitorum profundus, which flexes at the DIP joints, the distal joints. So what I mean by that is if you're the FDS and you're kind of in a squat with your legs open, I'm going to draw that on the hand so you know what I mean by that. The FDP, which is your little cousin, which I'm going to draw in green, is like coming through your legs, like crawling through them. So you can see I'm going to draw the green on the hand as well. So the FDP is a deep flexor muscle, and they're going to insert on the distal phalanges. Therefore, they're going to flex the DIP joints. So as you can see all the way to the left here, the two different tests, you can see the difference. So the FDS is in red, they flex at the PIP, and the FDP is in green, and they flex at the DIP joints. So some practical applications of the FDS, if someone has a weak one, they may have decreased wrist or grip strength, and they may have trouble typing, playing the piano, doing spirit fingers. You can see my little cat here is not too good of a typer. But that's about it for the FDS. Thanks.